Well, Two wants to know, how do we live with COVID from here on out? Just recently, health officials from states all over the nation met in D.C. to talk about how to transfer from pandemic to living with COVID. Dr. Betsey Tilson, North Carolina's state health director, just got back from the ASTHO COVID-19 Summit. She says the focus is making sure you have access to tools to protect yourself.
COVID will be with us, and there'll be rise and there'll be falls. So people need to think about what are their protective tools.
So what kinds of tools is she talking about? Well, things to keep you healthy, access and information about when you should get a vaccine or a booster, when you should get tested, when you should go and get treatment. Also, when you should be wearing a mask or when you don't have to, and when you should be isolating from others. She says as we live with COVID, as we deal with outbreaks, whether it be at work or at school, or we want to avoid an outbreak from a situation, we need to decide what tools each one of us wants to use and when.
I think about this as North Carolina in the spring, where some days it's 40 degrees and you need to have a sweater and a coat. Some days it's 85 degrees and you can have less layers. And so people are going to need to navigate their own personal risk and the risk of the spread in the community and think about how many layers of protection they want to put on.
So Tilson also mentioned this to me, which might be the best tool I've seen in a long time. It's the CDC calculator. You get started and it asks you questions from have you tested positive or do you have symptoms to have you had close contact with someone. And it goes through several different question scenarios. And as you answer them, it then formulates what should you do? Like, should you stay home and for how so long? And should you wear a mask? So often we have questions about our situation but can't really get a hold of a doctor. This does it for you. I have a direct link to this for you in the Two Wants to Know section. Just look for this story.